Okay, so this is our presentation in regards to the Mental Health in School Act campaign.
The background of the Mental Health in School Act is it was founded by Grace F. Napolitano. She saw that the Mental Health Caucus was inactive and wanted to pursue changes. She also wanted to work in the Latino field and was very interested in children ages 14 to 24. People suffering from mental health issues are more in danger to themselves than anyone else, and she believes that implementing this program in the schools would help children not be as much of a danger to themselves, but have somebody to talk to. So she started this program in 2001 in 14 El Monte City, California schools. This is mostly a Latino population, and when she started the program, she had got it funded through the local state agency, and then she started asking for the school act to be in place. She stated that has been successful so far, and over the last few years, she has added 4 more schools, the last one being added in 2013. She is pursuing to start this act for the whole country.
Okay, so we have statistics that we pulled from the Institute of Medicine website in February 2009. 50% of people with a mental health diagnosis first experienced it by the age of 14 years old, and 75% by the age of 24 years old. We also found that suicide is the 3rd leading cause of death of children ages 15 to 24 years old, and has doubled for 14-year-olds. Here is a chart that we pulled off the National Center for Children in Poverty website. It breaks down the suicide rates by age and gender of kids ages 10 to 18 in 2006. As you can see, the male ages 16 to 18 category is very, very high.
Okay, so missing from this research is a lack of data showing to the public that the Mental Health in Schools Act is much needed. This data is obviously out there, or the bill wouldn't have been passed, but as we were researching, we could not find it. So if you guys can find it, please let us know.
The action that we're taking is that we created a petition on change.org for more data from Napolitano and the stats that she has with the schools in El Monte. We also posted this petition on Facebook to get more signatures. Here is the petition that we made. It's to demand more data from HR 628 regarding mental health in schools from Congress. On the right-hand side is where you can sign the petition. It's very easy and will take you a little time to do. On this petition, we have statistics, and one of them is that 1 out of 5 students have some sort of mental health issues. And we also have a quote from Napolitano stating that the program has been proven to be tremendously successful in helping students overcome mental health issues and improving quality of life for them and their families. Again, we do not have the data to prove this, so by signing this petition, you are requesting data to support the Mental Health in Schools Act. And on the right-hand side, you can see people that have signed recently.
So for the results of the petition, it was posted on July 7th, 2014 on change.org, and each of us in our group posted it on our personal Facebook sites. And as of this day, there are currently 23 signatures. We would like to increase this number, hopefully as the campaign continues and we get the word out there and let people know about what we're trying to do. For the results, there were comments that were posted as they signed our petition. One of them was that there is a definite need for education and an open dialogue without the stigma attached to this horrible illness. Another comment was, I myself suffer from a mental health issue, and I know how hard it can be to cope with mental health without the proper support system and medications. Another participant stated, I agree, there is definitely a need. Lastly, someone said, this is an amazing start, but mental health in general needs to be prioritized and unstereotyped as a whole. It's so biased, and everyone automatically assumes you need to just buck up or that you're completely insane and need to be in a padded room. Too many lives lost to this silent disease.
All right, so after we did the petition, we also want to go further, and we have talked about going to back-to-school fairs to educate parents and school staff on this bill and the petition and how we need more data to really understand mental health. We want to post signs by back-to-school supplies in stores such as Target and Walmart in hopes that people will become interested and further research the topic and therefore sign the petition. And we also want to educate mental health facilities and free clinics to help them help their clients and to post signs and presentations so their clients will start asking questions. All right, our limitations. One of the limitations is that we only did it in the Kansas City, Missouri area and didn't branch out into the KCK area. We're assuming there's a need for the program, but there's not any data saying how the program works, how it worked, if it's still working. Which brings me to the bill stood still in 2013 and didn't progress, and there's no reason as to why it stopped. And we cannot do adequate research, such as interviews on human subjects. And there's a stigma of mental health. Everybody thinks people are crazy that have mental health issues, or nobody wants to talk about it.
Okay, so due to the lack of data, we are not sure where further research is needed at this time.
The implications of campaigning is to make the community aware of possible mental health programs. Through the lack of data are successful, this will be by going to back-to-school fairs and to put signs up and do programs. We just really want the data to be proven that the program is successful, and if it is, then we would like to have it into the school districts.
Okay, so if you guys have any questions, definitely please post, let us know what you think, and also please sign our petition if possible. Thank you.